Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us for another segment. In this segment, we're going to have a conversation with Dr. Tobias Barker. He's joining us here from Everside Health to talk about why value-based direct primary care benefits patients, providers, and employers alike. Welcome to Health Professional Radio. Dr. Barker, thank you for joining us.
Hey, thanks for having me, Neil.
Well, give us a bit of your professional background, if you would. Tell us a bit about yourself and your current role at Everside Health.
Sure. I'm a board-certified emergency medicine physician. I've had a variety of different roles, including working internationally in Dubai for a couple of years for a Harvard initiative and being the chief medical officer for CVS Minute Clinic. It's a chain of retail health outlets that's located in CVS stores. More recently, I've joined Everside Health as their chief medical officer about 3.5 years ago. When I joined, we were at about 40-some clinics, and we're now at almost 400. So really rapid growth in this model, and really proud of the things we're doing.
Talk a bit about Everside Health. What is your mission there and exactly what it is that you're involved in?
Yeah, I think so. Everside Health is a little unusual. So it's a direct-to-employer value-based care provider, and we serve self-funded employers. And that includes labor unions, school systems, municipalities, and other workforces. But yeah, this value-based model is really kind of core to the heart of what we do.
Now, to be clear, you're not an insurance provider or anything like that, right?
No, we are a provider that contracts directly with the payer, who in this case, in our case, are self-funded employers.
Now, I heard you mentioned value-based care. What exactly is value-based care?
Yeah, so when you look at what is value-based care, you kind of have to know what it's not. So the majority of the healthcare market in the United States is, as you know, fee-for-service, which means that providers like physicians and nurse practitioners are paid when they see a patient, which, by the way, usually requires the patient to leave work and go into the provider's office at a time and a place that's convenient for the provider. Anyway, this structure of only being paid when the patient is really sick creates a perverse incentive for the health systems and for the providers, because they're paid more money if you're sick than they do if they can keep you healthy. And this obviously doesn't seem right at a very basic level. So value-based care is set up on the philosophy that the main goal of a healthcare company should be to keep patients healthy. And so our relationships are established at a fixed cost to the payer, who, again, in our case, are usually employers who are self-insured, for the employees that they have. And so we're not only not paid more based on illness, we actually have money at risk to show that we're keeping the population healthy. So it's really a complete 180 compared with the philosophy of a fee-for-service model.
Yeah, I heard it once said about shamans and medicine men getting all of the chickens and the goats and the grain as long as people weren't dying and sick. Once they started not being able to cure them or treat them, they were kind of run out of the village because they were no longer of any use.
Yeah, that's the ultimate preventative care.
So direct primary care, that is your model.
Yeah, so direct primary care is another kind of term that's similar to value-based care, which is kind of opposite of fee-for-service. You could almost say that direct primary care is also, in a way, diametrically opposed to fee-for-service. So direct primary care is really defined kind of in the title by decreasing as many middlemen as possible in the relationship between who is paying for the medical care and who's providing the medical care. So currently, the U.S. has a much more complicated structure, as you know, where an employee of a company would be seen by a provider who then has to take the time to code the visit in a certain way and follow the rules of that insurance plan in order to bill the insurance company, which sooner or later makes its way back to the employer to actually pay for. So we simplify this by contracting directly with the employer to provide unlimited primary care for their employees. And because we don't have to worry as much about the nuances of these fee-for-service billing and coding requirements, which can really inhibit care, we're freed up to provide care in whatever way is most impactful for the patient. So if that means a text message at 10 in the morning followed by a video call at noon, then that's what we do. really whatever's most impactful for the patient. And we don't have to worry about whether or not there's a certain billing code that covers that, or whether there's a limitation to the number of touch points allowed under a particular insurance plan. We bypass all of that, which allows us to have a simplified relationship with the employer and really the freedom to interact with the employee patient in whatever fashion keeps them the healthiest.
Does the simplification automatically equate to a pay cut on the side of the provider?
No, it doesn't. The providers are extremely happy in our system. The compensation is equivalent to what it would be outside of our model, but there are a lot of different benefits to being a provider in our model as well.
What about as we age as a population? Does one or the other type of care structure suit an age better than the other?
I think having access to primary care, no matter what age you are, is going to be better off, and has been shown to be better off with, if you look at countries that have a higher percentage of their providers in primary care versus specialty care, those populations in general are healthier and live longer. And so I think access to care is a big thing in this country. And if you have a model where you have essentially unlimited access to primary care, where you have a real clinical partner as you go through your different phases of life, that's always going to be the most advantageous.
Are the things that are talked about in one type of visit versus the other different? Does primary care go more in depth during the patient visit, or is value-based care go more in depth?
Well, yeah, that's interesting. So if you look at the typical fee-for-service primary care practice, which usually is affiliated with a healthcare system, the real goal in those traditional fee-for-service models is to see 30 or more patients every day. And for those 30 patients, they can really only spend 10 minutes or less with them. And the goal, therefore, isn't really to try to figure out what's wrong and to help the patient. It's really to triage them to a higher margin department within that health system. And so this is completely different, where our providers on average have panels that are 60% smaller than in fee-for-service markets. They're able to accommodate many more visits per year, many more touch points for patients that need them, and much longer visits. And so what that means is we're not simply acting as a gatekeeper, shunting patients to the different departments of the health system, but really acting as, to quote our own providers, this is what I went to medical school for. They have increased time to get to know the patients and figure out the treatment plans that work best for them. And that's important, to be able to have a treatment plan that works for the patient. I mean, if you only have a couple of minutes with a patient who has type 2 diabetes, and usually that's caused by obesity, all you really have time for is like, hey, you need to work on your diet and exercise, and then I'll see you in a few months. Mm-hmm. Patients, that's not actionable. Patients have no idea what that means. And so nothing really changes. If you have the time, however, to kind of sit and get to know the patient, you realize that you can develop treatment plans that actually make sense and will actually be acted on. So you can say, hey, I know we've talked long enough. I know you have 4 Diet Cokes every morning. We're going to cut it down to 3 Diet Cokes every morning. And you have your son walk the dog, and can we agree that you're going to start walking the dog? And so, you can't have these kind of actionable treatment plans unless you really get to know the patient. And that takes time. You just can't do that in 5 to 7 minutes.
Talk briefly about how the COVID-19 pandemic, seemingly coming to some type of an end, is going to affect primary care settings.
Yeah, well, I'd say the only thing we know about these pandemics is that it keeps changing, and we don't always know what the next step is going to be. And so the important thing is to really have a clinical thought partner if you are an employer, if you're a payer, because you don't really know. When the pandemic first came out, all we knew for sure was everyone needed to kind of shelter in place, and the CDC had a list of conditions that if you had these conditions, you were more likely than others to get quite sick or increased chance of dying. And so we had these kind of at-risk conditions. And so we really quickly worked with all of our employers to rank order all the employees in terms of which underlying conditions they had. And then our providers called each of them, personally called, starting at the highest risk, those that had 6 underlying conditions that were thought to be harmful, and then 5, and then 4, to ask, do you have the meds you need to shelter in place? Do you have questions? Do we know what you need to talk through? And so That's what was needed early on. Later, it was vaccination. And so helping to work with employers to safely get people back to work, and to develop programs for those who are vaccine hesitant. To be successful in things like a pandemic, you have to be flexible, and you have to have, if you are a business, you have to have a thought partner that's able to flex with whatever the science is dictating and whatever, in this case, whatever the virus is kind of dictating.
Doctor, give us a website where we can learn more about Everside Health.
Yeah, our website is www.eversidehealth.com. You can go on the site, learn more about the type of care our patients are receiving, learn more about partnerships that we develop with you as a self-funded employer, and answer any other questions you have.
Well, I appreciate your time this morning. Thank you for joining us here on Health Professional Radio.
Thank you so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Tobias Barker, Chief Medical Officer at Everside Health. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.